Have you noticed that your semen volume has decreased dramatically? Or worse, that sometimes almost nothing comes out or even nothing at all? If you're over 50 and going through this, you're probably worried, confused, and wondering if this is normal, if it's something serious, or if your intimate life is over. Take a deep breath, because in the next few minutes I'm going to explain exactly why this happens, the real medical causes behind this phenomenon, when you should actually be concerned, and what can be done to improve the situation. I'm Dr. Amelia Tiller, and here on Male Secret 60 Plus, we talk honestly with science, no beating around the bush, about everything that affects the mature man's health. Stay with me until the end of this video, because the information you'll get here can completely change how you understand your own body and show you solutions you never even imagined existed. Before we dive into the specific causes, you need to understand the basics of how semen is produced and where it actually comes from. Many people think semen comes entirely from the testicles, but that's not true. The testicles only produce the sperm, which make up just 2 to 5% of the total semen volume. The majority of the volume, about 60 to 70%, comes from the seminal vesicles, two glands located behind the prostate. These vesicles produce a fructose-rich fluid and other substances that provide energy and nourishment for the sperm. The prostate contributes about 20 to 30% of the volume, producing an alkaline fluid that helps neutralize the acidity of the urethra and the female reproductive tract, protecting the sperm, and the bulbourethral glands add a small amount of lubricating fluid. So when we talk about decreased or absent semen, we're mainly talking about reduced production from these glands, especially the seminal vesicles and the prostate. The average semen volume in a young, healthy man is about 2 to 5 milliliters per ejaculation, roughly half to 1 teaspoon. As we age, it's completely normal for this volume to gradually decrease. Studies show that men over 50 have, on average, 30 to 50% less semen volume than when they were 20 or 30 years old. This gradual reduction is expected and part of the natural aging process. But what is not normal is a sudden drastic reduction or complete absence of semen, especially if it happened overnight. Let's now talk about the main medical causes that can explain why semen volume drops or disappears after age 50. The first and most important cause to consider is retrograde ejaculation. This is a condition where the semen, instead of coming out through the urethra and penis, goes backward into the bladder. This happens because the bladder neck, the valve that normally closes during ejaculation to direct semen outward, isn't working properly and stays open. The result: the man feels the orgasm normally, but little or no semen comes out. The semen that went into the bladder is then eliminated with the next urination, and you may notice that urine looks cloudy or foamy afterward. Retrograde ejaculation can be caused by several things. Diabetes is one of the most common causes, because poorly controlled diabetes can damage the nerves that control the bladder neck. Minus prostate surgery, especially transurethral resection of the prostate, TURP, for benign prostatic hyperplasia, can damage or remove part of the closing mechanism. Medications, especially certain blood pressure drugs, particularly alpha blockers like tamsulosin, doxazosin, and alfuzosin, can relax the bladder neck and cause retrograde ejaculation. Spinal cord injuries, neuropathies, multiple sclerosis, and other neurological problems can also affect bladder neck control. Retrograde ejaculation is not dangerous and doesn't affect overall health, but it can impact fertility if you're still trying to have children, and it can be psychologically distressing. Diagnosis is made by examining urine collected right after ejaculation. The doctor looks for sperm in the urine. If confirmed, treatment depends on the cause. If it's caused by medication, sometimes switching to a different drug is possible. There are also specific medications, like pseudoephedrine or imipramine, that can help strengthen bladder neck closure, though they don't always work. Another major cause of reduced semen volume is benign prostatic hyperplasia, BPH. This is an extremely common condition in men over 50 where the prostate enlarges non-cancerously. As the prostate grows, it can compress the urethra and also affect the seminal vesicles and ejaculatory ducts, interfering with semen production and release. Men with BPH usually also have urinary symptoms: difficulty starting urination, weak stream, frequent urination, especially at night, feeling like the bladder isn't fully empty, etc. Treatment for BPH can include medications or, in more severe cases, surgical procedures. Interestingly, some of the medications used for BPH, again alpha blockers, can cause retrograde ejaculation, as already mentioned. Blockages in the ejaculatory ducts can also cause low or no semen volume. These ducts carry semen from the seminal vesicles and prostate into the urethra. If they become blocked by cysts, stones, chronic inflammation, or scarring from past infections, semen can't be expelled. This can cause not only low volume but also pain during or after ejaculation because the fluid is trapped under pressure. Diagnosis can be made with transrectal ultrasound or MRI, and treatment may involve procedures to clear or dilate the ducts. Low testosterone levels can contribute to reduced semen volume. Testosterone is essential for the proper functioning of the glands that produce semen. As we age, testosterone naturally declines gradually, and in some men, the drop is more pronounced, leading to a condition called hypogonadism. Besides lower semen volume, low testosterone can cause reduced libido, fatigue, loss of muscle mass, abdominal weight gain, erectile difficulties, and mood changes. If you suspect low testosterone, talk to your doctor and get blood tests. If confirmed, hormone replacement therapy can significantly improve semen volume and all the other symptoms. Chronic or recurrent infections in the prostate, seminal vesicles, or urethra can cause inflammation that interferes with semen production and release. Chronic prostatitis, for example, can cause pain, discomfort when urinating, pain during intimacy, and changes in semen volume and consistency. Treatment involves antibiotics, if bacterial, anti-inflammatories, and sometimes pelvic floor physical therapy. Chronic dehydration can affect semen volume because semen is mostly water. If you're not drinking enough fluids, your body prioritizes vital functions and semen production may decrease. While this is rarely the only factor, staying well hydrated is important for overall health and proper bodily fluid production, including semen. Frequency of sexual activity also affects volume. Very frequent ejaculation with little recovery time naturally results in lower volume because the glands haven't had time to replenish fluids. On the other hand, very long periods of abstinence can also lead to lower volume on the first ejaculation, though usually higher afterward. The body reabsorbs unused seminal fluid during prolonged abstinence. Certain medications besides alpha blockers can affect semen volume. Some antidepressants, especially SSRIs, anti-epileptic drugs, certain psychiatric medications, and other antihypertensives can have this side effect. If you notice changes after starting a new medication, discuss it with your doctor. Lifestyle factors have a significant impact. Smoking, excessive alcohol, recreational drugs, obesity, poor diet, sedentary lifestyle, chronic stress, and lack of sleep can all negatively affect hormonal production and gland function. Exposure to environmental toxins, chemicals, heavy metals, and radiation can also impair production. Age itself is a factor. As we get older, all body glands become less active, including those that produce semen. The seminal vesicles and prostate produce less fluid. That's normal aging. But it's crucial to distinguish normal gradual decline from sudden or extreme changes that may indicate a treatable problem. Vasectomy cuts and ties the vas deferens, so sperm no longer reach the urethra. After vasectomy, there are no sperm in the semen, but volume usually remains almost the same because sperm are only a tiny fraction of total volume. However, some men report a slight decrease, possibly due to subtle changes in pressure or gland function. Systemic diseases such as kidney or liver disease, thyroid or pituitary disorders, and autoimmune conditions can indirectly affect semen production through their effects on overall metabolism and hormones. Now that you know the main causes, here's what to do if you notice a significant decrease or absence of semen. 1. Don't panic. Most causes are not serious and many are treatable. Second, pay attention to details. Was the change gradual or sudden? Do you have pain, blood in semen, urinary problems, fever? Did you start a new medication, recent surgery? Is post-ejaculation urine cloudy, foamy? Any signs of low testosterone, fatigue, low libido, mood changes? 3. Schedule an appointment with a urologist, the specialist best qualified for male reproductive and urinary issues. The urologist will take a detailed history, perform a physical exam, including digital rectal exam of the prostate, and order tests, post-ejaculation urine analysis to check for sperm, retrograde ejaculation, blood tests, testosterone, PSA, blood sugar, etc. Transrectal ultrasound or pelvic MRI to look for blockages, cysts, etc. Treatment depends entirely on the cause, changing medications, better diabetes control, testosterone replacement, procedures to clear blocked ducts, antibiotics for infection, etc. For lifestyle factors, the changes you can make are quit smoking, drastically reduce or eliminate alcohol, lose weight if overweight, eat a nutrient-rich diet, exercise regularly, sleep 7 to 8 hours, manage stress, and drink at least 2 liters of water daily. Some supplements may help. Zinc, crucial for prostate health and semen production, L-arginine, L-carnitine, vitamin C and E, selenium, and folic acid. Always talk to your doctor before starting supplements. The psychological impact can be huge. For many men, reduced or absent semen feels deeply tied to masculinity and virility. It can damage self-esteem and create anxiety around intimacy. Know this: semen volume does not define your worth as a man, doesn't affect orgasm pleasure in most cases, and your partner is far more concerned with connection and emotional intimacy than volume. Talk openly with your partner. Keeping it secret only increases anxiety. If needed, see a therapist to work through these feelings. Regarding fertility, if you're still trying to conceive, many causes, retrograde ejaculation, duct obstruction, low hormones, can be worked around with assisted reproduction techniques. Sperm can often be retrieved and used successfully. I've had patients in all these situations, one whose dry orgasm was simply a side effect of tamsulosin. He felt huge relief just knowing it was harmless. Another with low testosterone who felt 20 years younger after replacement therapy. A diabetic patient whose better sugar control partially improved the issue. A man with large seminal vesicle cysts that were drained and restored normal volume. Every case is unique, but almost all are manageable once properly diagnosed. Myths to bust. More semen does not equal more virility or fertility. Fertility depends on sperm, count, quality, not volume. No semen does not mean no orgasm. Orgasm and ejaculation are separate processes. Low volume doesn't mean impending impotence. Erection and ejaculation are different mechanisms. Prevention. Healthy lifestyle, good control of chronic diseases, regular checkups, and prompt treatment of infections all help minimize age-related decline. In conclusion, decreased or absent semen after 50 is far more common than most men realize, almost always has a clear medical explanation, and in the vast majority of cases is treatable or at least understandable and not dangerous. Don't suffer in silence, see a urologist, get answers, and take back control. Thank you for watching until the end. If this video helped you in any way, please give it a like. It helps us reach more men who are confused or scared right now. Subscribe to Male Secret 60+ and turn on notifications so you never miss a video. Leave a comment with questions or topic suggestions. I read every single one. And please share this video with a friend, father, or brother who might need this information. Take care of yourself, value your health, and never be ashamed to seek help. See you in the next video.